So now we will see about the excipients which can be used in liquid dosage forms. So the excipients which are used in liquid dosage forms, the first one is vehicles. So every liquid pharmaceutical formulation, every liquid dosage form need a vehicle. Vehicle is the major component in liquid dosage form, and it is the mainly the base for the drugs or other excipients to dissolve or to be dispersed. Means you will take a drug and you will take other excipients and you will disperse or you will dissolve that in one liquid. That liquid is called as vehicle. That liquid may be water or it may be alcohol or it may be anything. That is the vehicle. This vehicle provides base for the formulation of liquid. So they mainly function by breaking of bond and reducing effective charge on ions. Thus, it increases the solute solvent forces of attraction and it will form into solution. So that is very important. So that is why vehicle is one of the important excipient in liquid dosage forms. Example for vehicle is water and alcohol. Next, co-solvents. Co-solvents, you can see the here simply co-solvents means the solvents which are additional, which are added to the solvents for increasing its capacity. So they are called as co-solvents. They are the liquid components which increases the water solubility. So to increase the water solubility, the solubility of water with the drugs, we will add co-solvents. Examples of co-solvents are mainly glycerol, propylene glycol, ethanol, and low molecular weight polyethylene glycol. These are the examples of co-solvents. So what is the use of these co-solvents? The use of co-solvents is nothing but it increases the water solubility of drugs. It increases the solubility of drug. Next, surfactants. So what are surfactants? Surfactants are nothing but these are surface active agents or molecules with a well-defined polar and non-polar regions. These surfactants will contain polar region and non-polar region. Polar region means nothing but hydrophilic region. Non-polar region means nothing but hydrophobic region. So hydrophil, see in pharmacy, always you should remember phil means love. Phobia means hate. So hydrophilic means nothing but water loving nature. Hydrophobic means nothing but water hating nature. Hydrophilic means it is soluble in water. Hydrophobic means it is not soluble in water. So that is the difference between hydrophilic and hydrophobic. Our surfactants will contain hydrophilic and hydrophobic regions. They are associated in the surfactants. That's why they are known as micelles. Example of this surfactant is dimethicone, simethicone, ethylene glycol distearate. These are the examples of surfactants. Next, preservatives. So preservatives, in the name itself, it is used. It is used for preservation. So preservation means what? For storing. So preservatives are nothing but these are chemical compounds which are added to the formulation to protect the liquid dosage form from microbial contamination. So to protect from microbes, for sterilization of these liquid dosage forms, we will use preservatives. When you use preservatives, it does not allow microbes to grow in it. So that is why we will add preservatives for storing the liquid dosage forms. So examples of preservatives are benzalkonium chloride, alcohols, and parabens like methyl paraben and propyl paraben. Next, viscosity modifiers. Viscosity. What is viscosity? Viscosity is nothing but thickness of the liquid. Viscosity means it is the thickness of the liquid. It is the resistance of the flow. So that is called as viscosity. So viscosity modifiers are also called as suspending agents. They are used for suspending the drug particles in the vehicle. So that is why these viscosity modifiers are also necessary excipients. These are the one of the most necessary excipients in liquid dosage forms. Example of viscosity modifiers are methyl cellulose, microcrystalline cellulose, carboxymethyl cellulose, and ethyl cellulose. Next, buffers. So what are buffers? Buffers are nothing but these are hydrogen ion concentrations which resist the change in pH. Buffers are mainly used for resisting the change in pH. If there is any change in pH of the solution, when you add this buffer, It will resist, means it will hold that change in pH. It will maintain the pH of the solution. So that is why these buffers are used. Next, antioxidants. So antioxidants are added to the liquid dosage forms for inhibiting the oxidation process of molecules. The molecules which are present in the liquid dosage form, they will undergo the oxidation process. They may undergo the oxidation process. So to prevent that oxidation process, we will add antioxidants in the liquid dosage forms. Examples of antioxidants are ascorbic acid and alpha tocopherol. Next, chelating agents. Chelating agents, these are also known as sequestrants. What is the use of these chelating agents? They will protect the drugs from catalysts that accelerate the oxidative reaction. So there are some catalysts in the liquid dosage form that may accelerate, that may cause the oxidation process or oxidative reaction process. So to protect from them, we will add chelating agents. What are the examples of chelating agents? Examples of chelating agents are disodium editate, calcium disodium editate, and acetic acid, etc. Next one is sweeteners. Sweeteners, you know very well, sweeteners. Why we use sweeteners? For bringing the sweet taste. For bringing the sweet taste to the liquid dosage form, we will use sweeteners. Examples of sweeteners includes sucrose, sorbitol, mannitol, saccharin sodium, xylitol, fructose, corn syrup, etc. So we will add these things for increasing the sweetness of the product, so that the patient can take it very conveniently. Next one, flavoring agents. So flavoring agents means what? These flavoring agents are used to mask the taste of drugs, and also these will give flavor to the formulation. So the unpleasant taste is mainly masked by these flavoring agents. Examples of these flavoring agents are vanilla, raspberry, orange oil, lemon oil, etc. Menthol, like that. So those are used as flavoring agents. Next one is colorants. What are colorants? Colorants, you can see here directly. Colorants means what? Which will add color to the solution. So see, if you take it directly, then it won't look, the patient cannot take it perfectly. If it is in good color with his eyes, if he see that color, then he can take it very easily. So that is why colorants are added to the dosage forms. So examples of colorants, it may be natural and artificial. Example like carotenoids, amaranth, etc. Next, anti-foaming agents. So anti-foaming agents, in the name itself, you can see anti-foaming agents means which prevents the formation of foam in the liquid dosage forms. Examples includes polymethylsiloxane, paraffin, organic phosphates, and alcohols. Next, humectants. Humectants are examples like propylene glycol, glycerol, etc. These, what they will do, they will retard the evaporation of aqueous vehicle. Means sometimes what happens is the vehicle in the dosage form may be evaporated. So to prevent that evaporation process, we will add humectants, and these concentrations may also remove moisture from the skin. So they are called as humectants. Next, emulsifying agents. Emulsifying agents, mainly these are used for emulsification process. When you use oil and water type of liquid dosage forms, these emulsifying agents, what it will do is that will mix that oil and water perfectly. They will cause the emulsification of the liquid dosage form. Example is sodium lauryl sulfate, citramide, macrovols, etc. And then flagellating agents. Flagellating agents are nothing but these prevents the flaccules. They prevent the flaccules mean nothing but they prevent the caking of the solids. When you take solid into a liquid, sometimes what happened is the solids will aggregate and they will form into a cake-like structure. To prevent that cake-like structure, we will add flagellating agents in the liquid dosage forms. So these are the excipients of liquid dosage forms. These are the excipients which we can use in liquid dosage forms. Thank you. Subscribe to my channel for more and more pharmacy teaching videos. Jai Hind.